Well, it's a pleasure to be here on what is a snowy day here in Minneapolis. I'm coming to you from a medical building in downtown Minneapolis. So there's a building called the Medical Arts Building. It's 20 floors. I'm up on the 14th floor. Windows over there, and snow is flying. Um, so welcome to the COVID-19 telehealth training. A little bit of background. I would say that a month ago, we would have been lucky if 20 people were interested in this webinar. And we had nearly 1,000 people register for this webinar. And you know what I couldn't do in a decade, COVID has done in literally a couple weeks, which is basically spurred digital transformation. Everybody, because of the obvious reasons related to social distancing, needs to be doing telehealth, virtual health, things like that. And so here we are, rapidly spinning up a workforce to do that. There's a PowerPoint that's very brief. It's mainly my disclosures. As Joe mentioned, I'm going to be working off of a blog post, and the blog post should appear in the chat window. It also appears on the center's website. The reason I'm working off of a blog post is there's tons of embedded links, so it allows you to get at my resources very quickly and without trouble. I will not go through all my disclosures. You can look at them. You know, the big one is I'm employed by Allina Health, who is partnering with the center today to bring you the webinar. For those of you outside of Minnesota, from states outside of Minnesota, Allina is Minnesota's biggest health system. So we're based in Minneapolis, and we have a large geographic coverage in the state of Minnesota. And like every health system, we've been furiously pushing all of our providers home and doing virtual health and telehealth. And so my partner, John Sutherland, who's a psychologist, a PhD psychologist, and I have been tasked with spinning up all of our mental health and addiction programs virtually. So our partial hospital programs, our day treatment programs, our outpatient substance abuse treatment programs, individual therapists, individual providers, basically everybody has been sent home, and we've been spinning them up to do virtual care. So a lot of what I'm presenting today is what John and I have been doing internally at Allina, and Allina is basically giving it to the community so that other people can do what we're doing to create capacity, because really we're going to have to do this together as a very large community. No single health system is going to be able to deal with this pandemic alone, and so all the cross-pollination that is occurring is important. I'm going to go to my final disclosure because I think it's an important one. So I'm a physician, but I'm not an attorney. And so I will be showing you some waivers, some exceptions, some HIPAA related stuff, some documents related to that. So, you know, take it for what it's worth. You know, I think the plain reading of the documents is clear. However, if you are going to do something that you perceive to be risky, consult an experienced health lawyer. And in fact, I'm trying to lure my own lawyer, Teresa Knadler, into doing a Q&A next week. I would love to do basically a Q&A, just like we're doing today, where we basically go through the maybe 4 to 6 questions that everybody has about HIPAA, about Medicare waivers. If you're from Minnesota, the Department of Human Services has granted a bunch of waivers. And so I think that'd be helpful to discuss with an experienced health lawyer. All right, so what I'm going to do is I'm going to be doing a lot of screen sharing. And so if there's pauses, that's what I'm up to. I'm usually switching screens. The other thing I want to orient you to is my setup. I do not have an exotic setup. My principal device is a MacBook Air. I've had 3 of them. I love them. So it's just a standard off-the-shelf MacBook Air. And then above it, I have a large Dell monitor. And so I have a 2-monitor display. Camera is kind of dead center. And so if you kind of see me looking around, I'm navigating all of my real estate. So what I'm going to do is I'm going to share my web browser, and I'm going to get into the blog post. And so the pause that you're perceiving right now is me just switching screens. And this is my web browser. So this is the blog post that there should be a link on the center's website. Peter also, or not Peter, Joe also pushed it out in the chat session. The reason I'm working off of a blog post is all these hyperlinks will allow you to get at the resources that I'm going to talk around today. So I've already talked about my disclosures. So I'm going to sort of jump into technology. And so I made a fairly strategic decision when this COVID thing ramped up, is that the most useful piece of technology is going to be one that is device agnostic and operating system agnostic. There's a lot of telehealth platforms out there, but the less complexity, the better, because we're dealing with a lot of people and we can't have buggy sort of devices. We can't have problems. And so, I use video, which is a fine platform for facility to facility telehealth. So for example, I see patients or have been seeing patients who are down in New Ulm, Minnesota, which is a small town in southern Minnesota. They come to a clinic and sit in front of a camera. I'm in my office in Minneapolis, and video is the application that we use to run those visits. Epic, which everybody is using, at least in the Midwest, does have a plugin called Epic Warp Drive. And so it's basically like an AV chat client within Epic. Again, there's some complexity involved with that. You launch the visit on the patient side using MyChart. Not everybody's MyChart active. And so if you need to get up and running fairly quickly, I would recommend Zoom for Healthcare. Zoom has multiple platforms. You specifically want to do the healthcare platform. So don't use the freebie one, use the healthcare platform. There's a few reasons for that. One, you can achieve HIPAA compliance. And so it's a little bit more, but not terribly much expensive as telehealth goes. And it gives you the HIPAA compliance and the security features that you're after. And so I'm gonna talk a little bit about use of Zoom. There's other platforms, but I'll just show you as a metaphor how Zoom can be used, maintaining privacy and things like that. The thing to recognize about using any HIPAA compliant platform is that you should have something called a business associate agreement. This is just a standard federal feature. And so like darn near everything in my life, I need to have a business associate agreement. So I have a company that does secure shredding of my paper documents. You have to have a business associate agreement with them. I have an email vendor called Luxi. They specialize in HIPAA compliant email, web forms, things like that. You need to have a business associate agreement. And so Zoom for Healthcare not only gives you a lot of security features, they will give you a business associate agreement, which allows you to achieve HIPAA compliance. All right, well, let's just dive into the use of Zoom. Now, again, I'm using Zoom as a metaphor. There's other platforms out there, but I want to talk around some basic things that have to do with security and privacy. So what I'm going to do is I'm going to flip over here into my Zoom account. So here's my Zoom dashboard. Pretty standard looking Zoom dashboard. And I just want to talk a little bit about meetings. There's meetings you can think about as appointments. And there's typically two types of appointments that you would schedule. One would be an office visit or an individual session. So this would be you, the clinician, interacting with a single patient. And I'll show you how to schedule that. Although more importantly, we're running a lot of groups now in a virtual context. And so there are ways to schedule recurring meetings that are amenable to supporting groups. And I'll show you how to do that as well. And so scheduling meetings is really simple. I'm just going to click on schedule a new meeting. You give it a time. I'm going to do a one-to-one with John Doe. And really all you need to do from here is set the date and the time, so I'll leave that alone, and the duration. Now you can force fit in weird times like 1:10 p.m. You can fit in different durations, but I'm just going to tee it up for simplicity for a 1 hour one-to-one session with John Doe today at 1 o'clock. The things that I want to call out, now these are things that I've done in my settings, and I'll show you how to do that, but I've enabled something called waiting room. This is a security feature that basically puts people into a waiting room until the clinician enters them into the meeting. And this prevents unauthorized access to your encounters in your groups. And so what you'll see when people enter the waiting room, you'll see on your side in an interface, you'll see people queuing up, and you can admit them in mass. You can hit a button that says admit all, or you can admit people one by one. The key point here is that, again, you can see who is trying to enter your appointment or your group, and then you can make sure that unauthorized people are not admitted to it. So it's a nice security feature. I've toggled that on in my settings so that it is always a security feature. You can also manually toggle it on, but I've toggled it on like that. So really all you need, again, is whatever you want to call it, date, time, duration, and you hit save. Now from here, what you can do is copy the critical piece of information and get it to your clients. And so what I've done, just so you can see what I've done, over here, copy the invitation. The key piece of information really they need is this, a meeting ID, which is 9 digits, and a password. The other thing that you could give them is a one-click. This is a link specific to the session I've scheduled, so I'll one-click in, or a few telephone numbers. This gets pretty elaborate. I tend not to give everybody the entire meeting invite. I tend to give them what I've highlighted. In terms of getting it to clients or patients, there's a few strategies. Some healthcare systems, some clinics have encrypted email, and so you could simply copy and paste it into an encrypted email. A lot of, I think every electronic health record has secure messaging. So for example, with Epic, it's MyChart, where you can do an in-basket message. So you could copy and paste this into an in-basket message. Other electronic health records have similar portals, patient portals, where again, you could pop this into a portal message and send it off to the patient. Other options would be some systems, again, have encrypted, HIPAA compliant texting features for appointment reminders. For example, here in the Twin Cities, I'm a patient at Park Nicollet, which is a large healthcare system. I get appointment reminders by text message from them. So again, if you have a secure HIPAA compliant texting client, you could toss the key pieces of information into that. And then finally, you could go old school. You could simply just call people on the phone and give them the information verbally, either on a live basis or in a voicemail. But the higher level point is, from a security standpoint, meeting ID and password. You don't want to make this a public meeting. You're going to require that they use some security to get in. Now from there, it's just going to wind up in my my schedule. So here it is, and when the time rolls around, when 1 o'clock rolls around, I just hit start, and boom, the meeting launches. It's going to launch the Zoom client, and I can do my thing. I'm going to show you how to schedule a recurring meeting. This is especially useful for those of you who run groups. So if you run a partial hospital program, if you run an outpatient addiction treatment program, substance abuse treatment program, like an IOP, that can be very helpful. So what I'm going to do is do the same thing. I'm going to create a fake IOP. So I'm in Minneapolis. So I'm going to do Minneapolis day IOP. And I'm going to set up a series, and I'm going to start it on Monday. So I'm going to pretend that this is a Monday, Wednesday, Thursday IOP. So Monday the 6th, it's a morning IOP. So I'm going to start it at 9 in the morning. And it's a 3-hour IOP. So title, start date, start time, duration of each episode. Here's the key difference. You want it to be a recurring meeting. I'm going to recur it daily, every day. And then I'm going to just run it out for about 4 weeks. And so my start date is Monday the 6th. I'm going to run it out into May, and I'm going to stop it on May 1st. So it's going to run out for 26 occurrences. Now you'll recall that I said this is a Monday, Wednesday, Thursday IOP, and I've set it up for a daily occurrence. And that's very intentional because you want the meeting ID and the password to remain stable from day to day. You could get really cute. You could create a series for Monday. You could create a series for Tuesday and Thursday. You would effectively have 3 series. The problem is then your patients would have 3 meeting IDs, 3 passwords. It could create confusion. And so the reason I do it this way is to have a stable meeting ID and password from day to day. Now there's a way to fix all the occurrences you don't need on the back end, and I'll show you how to do it. So again, high level, the name of the group, start date, start time, duration, it's recurring. I'm going to recur it every day, and then I run it out for 4 weeks. Same default settings, and so boom, there we go. The invitation is a little messier, but what I would do is copy and paste this into, say, an email client. So if you're going to use encrypted email to give it to somebody, or if you're going to print it and mail it out to them, I would edit out the occurrences you don't need. And so that's fairly easy to do. So you just copy and paste the whole meeting invite. I do it to right around there. And then what you do is you delete the occurrences you don't need for the meeting invite. Now on your end, the clinician end, we're going to have occurrences we don't need. So recall, I told you this is a Monday, Wednesday, Thursday IOP. So this Wednesday occurrence, I don't need. So I'm going to delete that occurrence. I do not need the Friday occurrence. So that will go away as well. Saturday, Sunday, same story. So, I mean, it takes a minute, not more than a minute, but if if you set it up this way, you can go in and quickly clean your calendar so that all you're left with is the actual occurrences that you need. And so here's the first week of my IOP, Monday, Tuesday, Thursday. I've deleted the unnecessary occurrences. I would basically clean the rest of my calendar to retain just the occurrences I need. Super high level, again, I do that because I want the meeting ID and the password to remain stable from day to day to minimize confusion. Now, there's been lots of attention in the media recently about Zoom bombing, people penetrating meetings that they shouldn't. I will tell you there's a lot of security features here, and if you avail yourself to the security features, your risk there should be low. And so under settings, you can enable a ton of security features. I'm going to make you dizzy and go kind of toward the bottom, but this is where you can put people in waiting rooms automatically. And so you can toggle on waiting rooms. That's my default. So all participants wind up in the waiting room until I personally admit them to the appointment or meeting. Again, I don't want to admit people unless I'm convinced that they should be in the session. The other thing you can do is if somebody enters your meeting, you can remove them. So again, there's a little controller that you're going to see with all the participants. You can mute their mics, you can play with their camera, but more importantly, if you need to, you can remove people from your meetings. So again, before you get up and running, I would review some of the security stuff that Zoom has talked about and enable it. I mean, they do take security seriously, and there's a ton of security features right here that allow you to protect your meetings. So, the Zoom bombing, I think, is more of an issue with public meetings where, somebody pushes out a meeting invite to the general public. There's really not a lot of security in terms of entering the meeting. And so you can control a lot of this. I've joked with people that people probably can run in the front door of my office and penetrate my clinic more readily than they can sort of penetrate a digital meeting or appointment that I'm running. All right, so that's scheduling and security. Again, I'm just using Zoom as a metaphor. Whatever platform you wind up on, think it through how you want to schedule individual sessions, recurring sessions, how you want to cascade the meeting information out to people. I gave you a number of options to think about. My charting, digital, secure email, encrypted email, things like that. All right, let's move on to conducting sessions. And so conducting sessions requires a little bit of socializing for both individuals and group. At the end of the day, they're in their home, and a lot of times they're a little too comfortable because they're in their home. But I think what you want to do is you want to socialize them to the fact that this is a professional encounter. They should think about the appointment in the same way that they think about an appointment in your office, how they present in your office. You want to sort of emulate that. There's some things that are specific to virtual health that I think you really should address with every new individual and every new group member, starting with physical safety. So for example, I'll give you a real live example from my world. About 2 weeks ago, I teed up a virtual visit that was scheduled. It wasn't like it was a surprise visit, so when the time rolled around, I launched the visit, and the patient was driving his car. The smartphone was on his thigh, from what I could tell, his left thigh, kind of looking up toward him and the ceiling of his car, and he was driving his car. And so, encourage people to do these visits in physically safe places. Don't conduct sessions from cars, things like that. The other thing is everybody's at home. Clinicians are at home, patients are at home. Think about privacy, especially in shared spaces. And this is where headsets and earbuds can be really helpful. So for example, I'm in a private office right now, but if I was in my home, my children could potentially hear me talking, but if I have a headset on, they wouldn't hear my patients talking, they wouldn't hear a group discussion going on. And you can encourage the same thing actually on the other end. You can say to your patients or clients, look, if you're in your home, I'd really like you to either be in an absolutely private spot, you know, so if you can get into, say, a bedroom or home office and close the door where people won't overhear what we're talking about, or if you can't really do that reliably because you're in an apartment and people are on top of each other, please wear a headset or earbuds so that the people in your environment aren't overhearing what we're talking about. They'll hear your voice, but they won't hear what else is being said. Minimizing environmental distractions. Sound is an obvious one, and so having people mute their microphone in groups, especially when they're not using it, can be helpful. Light actually can be an issue, you know, so for example, somebody might sit on their couch with their tablet or their laptop, their back might be to a window, the sun might be coming right in on the camera, and so that can be a somewhat obnoxious environmental distraction, and more importantly, you really can't see the person, you can only see the light. And then motion, so if people are using handheld devices like phones or tablets, you know, they can motor around their house, you know, and they can get people dizzy. You know, I'm sort of screwing around with my laptop right now. So just encourage people to minimize environmental distractions. Again, they're in their homes, but encourage them to think about this as a professional appointment. So the things that would not occur in your office shouldn't occur during a virtual visit. So encourage them to defer personal activities like smoking, vaping, eating, toileting to personal time. You know, I've had vaping recently where somebody pulled out a vapor pen. So encourage people to sort of, you know, defer those activities. If you're running a group, of course, you're going to probably give people breaks, you know, so if you're running a 3-hour group, you might run for 45 to 50 minutes, put the Zoom session on pause or the telehealth session on pause and allow people to attend to their personal needs before returning. And then if you're running a group, encourage people to keep their camera on. I mean, part of the magic of a group is that you're interacting with other people. I mean, that's part of the therapeutic element of a group. And so video on, especially for groups. And then if they can toggle their audio on and off as needed, especially during groups, so people aren't talking on top of each other and creating a mess. Moving on to looking and sounding professional. So I have three kids, one's 12, one's 15, one's 17. I see way too many stupid YouTubes. And my goal as a physician is to exceed the standards of the creepy basement YouTubers that my kids watch. And so there's a few things you can do that make a big difference, small touches that make a big difference. So for example, think about lighting. You can't see what's going on in my office, but I have two lights right here to my right and my left that take the shadow off my face. Otherwise, I might be in shadow because the only light would be from the top. And so there's cheap solutions on Amazon. This is the one that's worked well for me. I have one of these on either side of my desk, giving some soft light, taking the shadow off my face. Place the camera at eye level. And so again, with my setup, I'm using a MacBook Air, which has a built-in camera on the top of the screen. I have it elevated off the top of my desk, probably 5 inches. It's on top of a box, and it's not even a fancy device holder. It's just a box that I received something in, some medical supplies in. And it allows you to have eye contact with people. Otherwise, the camera is below you. It's often shooting up. It's kind of weird. It's kind of distorted. People are going to see your ceiling. Shadowing can be an issue again. And so just try to get the computer up or the camera up so that it's roughly at eye level and you're looking people in the eye. I've already talked about this. Use a headset microphone. I like Sennheiser microphones or gaming headsets for a few reasons. I mean, they're really comfortable for starters. So if you're going to do virtual health all day long, you want something comfortable on your head. The other thing that's nice, they have noise canceling microphones. The microphone is close to my mouth, and so it's better audio quality than a microphone that's distant from me built into a computer. There's also other features like you can tip the mic up. And when I tip the mic up, it mutes me. And so it's another way of, again, showing etiquette when, for example, I'm in a group. It gives me another mute option. Select a a bland background. My office has a pretty bland background. I mean, it's a professional space where I'm actually normally seeing people in person. But if you're in your home, you may not have a background that you wish to display to people. I was dealing with another clinician earlier this week, and she was in her kitchen, and I understood why she was there. But you may not want to present your refrigerator to clients. And so if you're unable to find a bland background in your environment, you can blow in a virtual background. And that's, again, a feature in your telehealth platform. Zoom, for example, has a virtual background option. Again, pick something professional, give some thought to your background. Don't blow in odd things. But you can, again, control how you present yourself professionally through the use of a virtual background. On your end, minimize environmental distractions to the extent you can. Your kids and dog, for example, may be the distractions. We have 3 kids who are stuck at home and we're doing distance learning. So try to the extent you can to minimize environmental distractions. Look into the camera, because that's where actually the patient is. And so, they may appear to be elsewhere. The patient may be in a chat session off to the side on a screen, but return to the patient, make some eye contact periodically through the camera. I'm often moving around my screens. So for example, when I'm doing telehealth encounters, I have Epic running on my smaller screen, the electronic health record, and I may have the picture of the patient above the camera level on my second screen. So I'm charting in Epic, which is below the camera level, but I'm going to want to pause and make sure that I'm making eye contact with the patient from time to time. So again, it emulates a clinical encounter that you would do in real life. And then finally, keep your camera clean. People are forever putting their fingers on their camera and smudging it. And so it's pretty easy to clean your camera with optical wipes. I have these Target optical wipes that are really cheap. And, just clean your camera from time to time so that it remains crystal clear. Moving on to documentation. So this is a thing that's been around forever, and I want to just sort of point out that you have to have some elements in your documentation that make it clear to readers, and the reader may be the insurance company if they ever want to look at your documentation. You want to make it clear to readers that it was a telehealth encounter. Otherwise, the presumption will be that it's an in-office visit. And so this chunk of text appears at the beginning of all my telehealth and virtual health visits. And these are elements that make it clear what service I rendered and the fact that it was a virtual visit. If you're an Epic user, you'll recognize the 3 asterisks or the wild symbol that you can use F2 on your keyboard to advance through. But if you're using some other platform, you can change them to the wild characters that allow you to advance through by tabbing or however you get through your notes. But the key point is, put this in your notes at the very beginning. Date of service, start time and end time refer to camera time, not the time that you finished your documentation after the visit. So when did the camera fire up? When did you end the session on camera? So start and end time. Describe the service. So I'm a physician, and so I'm using E&M codes for the most part. So evaluation and management code, that's the type of service that I did. What type of encounter was it? Well, it was a telehealth encounter or a virtual health encounter. Telehealth technically is facility to facility. So in my case, the facility is a hospital in southern Minnesota where there's a clinic. And so the patient's sitting in front of a camera in the clinic in that hospital. Or virtual health. Virtual health is I'm in my office or wherever, and the patient is wherever. So just describe the type of encounter. Make it clear, this is the essence of virtual health, make it clear that you're using secure, synchronous, real-time audio and video communication, and then whatever your platform is. So for telehealth, I use video. You can plug and play, put whatever platform is in there. But it makes it clear, again, to readers, or more importantly, if you were asked by an insurance company to produce a note, it make it clear that you're not using a telephone. You're actually using what is appropriate for telehealth. Where the patient is, city and state sufficient. So Eagan, Minnesota, Brainerd, Minnesota. Where you are, the distance site is you. So I'm in Minneapolis, Minnesota. almost 100% of the time. And then why you feel the service can occur virtually. This sentence is probably a keeper. Virtual health is appropriate because of the pandemic and the need for social distancing. So that's probably a keeper. You know, and this is peculiar to me. You can modify or delete it. You know, most of these patients I've actually seen for traditional in-office care. But I want to make it clear to readers, look, I've given this some thought. I think they're appropriate to do a visit in this way for the following reasons. Again, the big point here is take your existing notes that you use for in-office care. So either your one-to-one session type notes, in my case, they're evaluation and management visits, or your group template, whatever template you're using for your groups, and then make a clone of it, a copy of it, modify the copy or clone, and then throw this text at the very beginning to sort of meet muster in terms of telehealth. Clinical data. So I love scales, measures, patient self-rating forms. I'm just a total nerd when it comes to measuring stuff. I love to measure stuff. And a lot of this happens in my office where I hand somebody a form when they present for care and they fill it out on paper and then I scan it and then the PDF winds up in a electronic health record somewhere. The problem is when they're not in my office, I can't hand them a form. So there are ways to hand people the same sorts of documents, almost identical documents digitally. And I'm going to give you a couple, 3 options here. One is with a HIPAA compliant form. And I'm going to point out the HIPAA compliant piece. Do not use like Google Forms. Do not use SurveyMonkey to conduct or acquire clinical data. Use a HIPAA compliant vendor. I happen to use one I have for probably about 3 years now, Luxi. They specialize in secure email, encrypted email, and secure forms. Zach Miller, big shout out to Zach Miller. He's my builder at Luxi. So this is a digital version of a paper form. When people present to my office, they usually fill this out on paper. So this is a secure form that they fill out, the same elements that they fill out in my office, they fill out on the secure form. Stuff like a PHQ-9 is right here. There's a GAD-2, some questions about mania, psychosis, homicidality, medication side effect questions. Again, people fill this out on paper in my office, and then it gets scanned up into an electronic health record eventually. And so this is a digital version. You basically give the patient the secure form and you say, hey, you need to fill this out the morning of the visit. Or you can even have them fill out at the top of the visit. You can just say, hey, you know, you usually fill this out in my office. I'm going to give you five minutes or so. Pull up the link to the form that I pushed out to you, complete it. And once you've completed the form, we will begin your visit. The end result of this form, by the way, is a gorgeous looking PDF. And so all this data gets dropped into a PDF that's delivered to me securely by email. And then the PDF is easy to upload into an electronic health record. Other ways to do it, testing vendors. So Pearson, Minnesota-based Pearson, so I have to bring up Pearson, but I have a bunch of testing vendors. Pearson has a platform they call Q Global. Q Global allows you to administer a lot of stuff remotely. And so what you can do through their secure platform is you can enter the patient's name, their email address, you can assign the test, I'll just loosely call it test, and then an email goes out with a link. Patient clicks the link, they're dragged into a secure testing portal, and they fill out the rating scale for you. So common rating scales that Pearson has available: Beck Depression Inventory, Beck Anxiety Inventory. They have one called the Quality of Life Inventory that I use. I love the Quality of Life Inventory. So they have a ton of tests that you can push out to the patient, and they get a link, secure link, they click the link, they complete it, and then you get a notification when the test is complete, and then you can, again, download a PDF, a beautiful looking PDF of the testing results, and import it into your electronic health record. And then finally, document cameras, I think are pretty nifty. I ripped this off from teachers, 100% ripped it off from teachers, and so I'm going to show you what a document camera is. So I have the middle option. So this is a weighted base with an arm with a camera on it. There's a down-facing camera that looks at the desk. There's a light that also faces down. It's a USB device. And then I'm gonna actually change my screen share so you can see my physical desktop. So here comes my physical desktop. And so here's my hand, and there we go. There's a back depression inventory. And so it's just an example of something you could do with a patient. And you can go through the instructions with the patient, and then you can sort of dive into the questions. I will make you dizzy here, but if you need to, you can get in real close. And you can serve as the patient scribe. You can say, all right, what's your answer for sadness? Again, it's the last 2 weeks, including today. How sad have you felt? And you sort of march through the form. And, there's a backside as well. So this is a nifty way to, if you need to administer documents on paper in the same way as you would in your office. The main distinction here is that you serve as the patient scribe. And you make that clear that, this was administered through a document camera. You just make it clear that you were serving as the scribe for the patient and how it went down. For the psychologists who are part of this webinar, I want to get you thinking. You can present stimulus materials to patients in the same way. So for example, if you wanted to administer a TOM or a dot counting test or whatever stimulus book that you would normally administer in your office, you can again plop it down on your desk and administer it. The testing vendors would say that, just make sure your documentation is clear that this was an adapted administration, that you followed the usual protocol for administering the test, but it was adapted and done in a virtual manner using a document camera. Just make it clear that it was not a live administration. So again, the larger point, switching back to my screen share, is that there is a number of ways to acquire clinical data: custom forms, testing vendors with portals, document cameras. I'm also way okay with home drug testing, and I was okay with this before COVID. And this is for largely stable patients. I would say that pick a test though that has some robust validity features, validity assays that look for adulteration, that are assessing for creatinine. The one that I direct patients to use has a confirmation of all positives. And so the test that I recommend is, currently $35 cash. So it's not very expensive. And the patient orders it online. The whole thing comes by mail. The patient provides a urine sample. They return it to the lab in a mailer. There's a PIN number in the kit. I need the PIN number to access their results. But it's a robust assay. This one I like because there's a buprenorphine, a Suboxone component to the assay. And so this I find valuable for patients who are on Suboxone because they should be positive for Suboxone. And that's one way that I get a hint that they probably didn't substitute somebody else's urine. They should be positive for Suboxone, negative for everything else. So again, you may want to think about how you modify drug testing in the realm of COVID. I'm not sure I want my patients, unless they're very high risk for substance abuse or diversion, to be presenting to hospital labs or clinics and potentially being exposed. And so think about ways that you can do this. Finally, some notable waivers and exceptions. I was thinking through a title for the webinar I want to do next week. I think I would title it the wacky world of waivers, or the wild and wacky world of waivers. Pretty much every regulatory agency has granted a bunch of waivers. And so I'm just going to point you to a few. Again, I'm not an attorney, but I would point you to these documents. You can see if the plain meaning of the document is clear to you. And then if you need to, you can consult an attorney or privacy officer. This is from Medicare. And right down here, the Office of Civil Rights, which is part of the Department of Health and Human Services federally, they're responsible for prosecuting HIPAA violations, investigating and prosecuting HIPAA violations. And they basically stated, due to the public health emergency, they are not going to be terribly aggressive in terms of HIPAA. And in fact, if you as a clinician in good faith use everyday communication technologies like FaceTime or Skype, you're probably not going to be in trouble. Now, with that said, I think the barrier to entry with HIPAA compliant technology is really low. Honestly, if you look at what a Zoom license, Zoom for healthcare license is, it's not very expensive as health IT goes. But even so, if you had to, in a pinch, resort to something like this in good faith to deliver care to a patient, a vulnerable patient that could have a very bad health outcome, the feds have said, you know what, we'll spot you some grace. That's the way this reads to me. Again, consult your privacy officer, consult your own attorney, but this I think is a helpful dispensation during the time of the pandemic. Other interesting ones, I'm going to skip Ryan Haight for just a minute. Medicare. Medicare has been a barrier, honestly, to telehealth for a long time. Medicare really, from a telehealth standpoint, wants to serve rural areas where there aren't clinicians. And so historically, clinician like me in a big city, patient in an under-resourced area, in the case of Minnesota, they're in a small town in greater Minnesota. But Medicare has said, you know what, you're off the hook with that one too. And so this is a document that basically describes the waivers that they've granted. And I'll make you a little bit dizzy, but basically they're stating, starting March 6th, you may do telehealth. And doctors, nurse practitioners, clinical psychologists, social workers, etc. And critically, this is helpful, they'll pay for it. Not only can you do it, you'll get paid for it. And so key takeaways, for the purposes of this waiver, these will be considered equivalent to in-person visits and paid at the same rate as in-person visits. And so for the Medicare population, again, this has been a big deal when it comes to telehealth. This is a game changer. This allows you, for that population, to use telehealth in ways that you couldn't do prior to March 6th when the public health emergency was declared. I know a lot of people who aren't from Minnesota are part of this webinar, but I'll just, for the Minnesotans, I will note that the Minnesota Department of Human Services has granted waivers. Please consult the waivers. But here you go, expanding access to telehealth for medical assistance, basically the Minnesota Medicaid program. So again, you're going to want to look at that and see what you can do with it. But again, they're thinking the same way everybody else is. These measures will keep people in their homes and allow social distancing. I have no doubt, like one of our earliest people who entered the webinars from Pennsylvania, I have no doubt that whatever your Department of Human Services is called in Pennsylvania, they probably have waivers too. I'm sure every state for their Medicaid population, because it's a federal program administered at the state level, they're going to have waivers and modifications. So do consult your waivers and modifications. And then finally, I'm going to mention the Ryan Haight Act. This is designed more for the physicians, nurse practitioners, and physicians assistants on the webinar, for those of you prescribing controlled substances. The Ryan Haight Act governs the use of telemedicine for prescribing controlled substances. And in my world, the controlled substance is Suboxone. And so there's some rules about establishing care. And at the end of the day, you probably have to establish care generally in person. There's a few exceptions. And I can actually meet one of the exceptions because the patient is at a critical access hospital in a small town. There's some exceptions to the Ryan Haight Act, but for most clinicians, you're going to have to establish care in person. And once you've seen somebody in your office once in person, then you can begin seeing them on a virtual or telehealth basis and prescribe and manage controlled substances. That's the way the Ryan Haight Act has worked for years. There is an exception now, and I'm going to point you to the Drug Enforcement Administration's exception. There is a public health emergency exception to the Ryan Haight Act. And so you're going to kind of want to drill into the exception. So use the telephone for buprenorphine prescribing. Exceptions have been granted. So this would be, for example, the heroin user who you've never seen in your office, so you've not established care in person. The only way you can reasonably establish care is through virtual health. And so they're in their home on an iPad, you're in front of a screen wherever you are. this exception until the public health emergency ends would allow you to do that. That would be permissible until the public health emergency ends. That's all I really had planned. These are the high level things that I think practitioners of various disciplines need to consider. The blog post is out there. All the resources are live. And then at this point, I know that Joe Curtis, Peter Dimick have been curating the tons of chat that's been in my periphery. And so Joe and Peter, I'll entertain questions until you shut us down.
All right, thank you, David. We do have some questions, so I will get right into them. Can you hear me okay?
I can hear you great.
Okay, I am pressing my space bar to unmute right now. Carissa asks, how do therapists living in close quarters with their partners do telehealth with their clients and patients while maintaining as much privacy? In other words, what if you're in a studio apartment?
Yeah, and that's again where I think you're gonna critically have to use a headset. And so they'll be able to hear what you say, but hopefully they're not going to see your screen, so they're not going to see the client you're treating, and then more importantly, they're not going to hear what the client is saying. And so, yeah, we're in strange territory here where you're in close quarters. And so my top recommendation is get a headset and then just make sure they can't see the screen.
Thank you. That's great advice. Amy had two questions I'm going to bundle together here. Amy wants to know, what brand of headphones did you say you like? And when you say optical wipes, do you mean those little small packets with the damp paper cloth inside used for eyeglasses?
Yes. So I love Sennheiser. Sennheiser makes a range of headsets. They're just really comfortable. I like them. Nice noise cancellation, stuff like that. And then, yeah, the optical wipes. I have a box of optical wipes from Target that I can also use on my glasses. So, yeah, just keep your camera clean. Actually, this is a pet peeve of mine. Keep your scanner clean and keep your fax machine clean. I hate getting faxes with a big streak down it because there's adhesive on your platen. And so, yeah, keep your equipment clean.
Perfect. Thank you. So many questions coming in. Keep them coming. Thank you. Jillian asks, what are you and your clients feeling challenged by most with this type of interaction? What are the solutions that have arisen? And she wants to confirm that it's a compliant method or if you recommend a different method of delivery.
Yeah, I'm a rule follower. I'm fundamentally a rule follower. Ask my attorney. I'm a paranoid rule follower, which is probably good to have in a doctor. So I would always recommend you use a HIPAA compliant solution. And so that's why, I've landed on Zoom for healthcare in my private practice, for example. It's a HIPAA compliant solution. There is that exception, the waiver that I showed you. So if you had to, in a pinch, an absolute pinch, use a non-compliant solution, you could, probably without risk of being prosecuted or penalized rather. But yeah, the barrier to entry is really low. I mean, you can get a license for a HIPAA compliant solution for not very much money. It's actually one of my cheaper health IT things in my private practice. I pay more for my billing software on a monthly basis than I do for my telehealth platform. In terms of challenges, I mean, I like seeing people in person because really on a telehealth platform, you see them at best from the shoulders down, and so you can't evaluate people for tardive dyskinesia quite as well because you can't see their arms and their legs, and the possible movement disordery sort of stuff. I can't measure their blood pressure. In my office, I can do 1 lead EKGs, which I do if they're on atypical antipsychotics. I zap their eyes with something called a pupillometer. So the stuff that I do in my office, I miss. I think that has value. And even when this pandemic ends, I'm probably going to haul people in at least, a couple times a year just to sort of do the things that you would normally do in person. So that's what I miss. In terms of patients, I don't know they miss the in-office stuff all that much. Some of my patients are hourly employees that if they have to take time off of work to come to my office, it's unpaid. And so for some of them, I think it's a win. I'm not sure they necessarily miss having to forfeit income, drive downtown, park, all that stuff. And so I'm not sure they're perceiving it to be a big loss. but the jury's out. I should probably assess what they miss the most. They may be too embarrassed to admit they miss nothing about coming to my office, but we'll see.
Thank you, David. Natalie asks, can Zoom be utilized for training purposes for clients? For example, can it be used to record a training and send to clients to watch later, or is it only for live meetings? My agency typically requires an in-person training that is facilitated, so we're trying to do it online via Zoom.
Yeah, so Zoom does have a recording feature. Now, I will tell you that once you execute your business associate agreement, they disable that for data privacy reasons. And so, you know, that's a tough question to answer directly, but there is a recording option. That actually reminds me, Joe, I forgot to mention something about screen sharing. Everybody has probably noticed that they have a little green banner with the meeting ID. It starts with a 232. Above the meeting ID, you can share screens. And that's how I've been flipping around and sharing my screen. I want to show you how you can use a screen share to do, say, psychoeducation. And so here I am back using Acrobat. This is a standard CBT form that I use in my office. And so I hand it to people and we use it didactically in my office. You can do the same thing. And so this is just a PDF on my desktop. I've selected it. You can pull it up. You can mess around with it. You know, so this is just standard CBT. We're going to tell me what happened. You know, tell me what emotion happened. Tell me what behavior happened. You know, then we're going to sort of drill into the irrational beliefs that mediated between A and C. So for those of you who are running groups, if you have a DVD that you tee up with regularity, you can do the same thing. You can tee up the DVD, screen share it out. So anything that's on your screen, you can share with people in a virtual way. So that escaped me, but I'm glad it came to me so I could demonstrate that.
Thank you, David. Mimi asks, can you comment on practices or resources for delivering telesupervision?
Yeah, that's interesting. So they could, in theory, audit a session live. Not that most supervisors typically do that, but I suppose in a training setting, it really, I guess, depends on what you mean by supervision. If it's fully licensed and it's that kind of supervision, or if it's more in a training setting. So they certainly could drop in on one of your meetings live and watch some or all of it. Again, Zoom, until it's disabled, does have a recording feature. And so I know the psychologists that I work with they're still the only people on the planet who listen to cassette tapes. So that could be your version of the cassette tape. And so there's a few options there in terms of telesupervision.
Hey, Joe and Dr. Frenz. I've got quite a few questions on my end, which I know we're not going to get time to answer all of them today. So I'm just wondering if we can let our participants know how these questions can be answered.
Yeah, so Peter, that was Peter, and Joe are furiously capturing all this stuff. And then we're going to theme it out, because a lot of these are kind of recurring questions. Theme it out, and then we're going to put a Q&A out on the center's website. And then again, my hope is that we'll get an attorney on camera next week, a health attorney, health lawyer, to sort of more directly address your niggling questions about HIPAA and 42 CFR and the sort of nitty gritty legal sort of stuff that I don't want to necessarily be the authority on. So does that help, Peter?
Yeah, that helps a lot. And so Joe and I will work on getting these questions collated and then get them to you, and we can start putting that together.
But yeah, we'll post it. It's Friday, and I hope not to work much this weekend. I believe I will be installing a basketball hoop on a 14-foot trampoline for my children. I'm the Phy Ed teacher right now, so that's our Phy Ed class, one of the elements. But next week is my point. Next week we'll hopefully have the Q&A out there. And then Joe, can you alert people when the Q&A goes up?
Yeah, we'll probably start working on this Monday. And everyone, keep an eye out on your email. As Dr. Frenz mentioned, we're trying to, get an attorney online to answer some more of your technical questions, and that'll come together quickly, and you'll get a blast from MailChimp. So keep an eye out for that.
Okay, and one other thing that, could you just post again, Joe, on the chat box or in the chat box, the link to Dr. Friend's post where all the resources are? I've been getting a lot of questions asking about that, and probably people just didn't see it to begin with.
Yeah, honestly, Joe, I'm gonna screen share as well. I'm gonna go to the center's website quick. And so the center is right here. This is the webinar, and so here's the blog post embedded in the meeting announcement for the center. So that's one place you can get at it, and then Joe can blow it into the chat. There it is. Blow it in there. And again, we're doing this by blog post because you want access to the resources. A PowerPoint I don't think is going to be super helpful. You want to get right at the stuff that I talked around.
Great. David, do you have time for a few more questions with us today?
Let's do it.
Great. Continuing. Nina asks, is there a tablet that's most compatible with doing Zoom sessions for outpatients?
I think they're all very compatible. That's one of the reasons I like it. So it's sort of device and operating system agnostic. I'm just going to go right here. They will need a mobile app. And so if they are an Macintosh, iPhone, iPad user, they just go to the App Store. If they're an Android-ish type user, they go to the Play Store. The general feeling actually among again, I'm not an IT expert, so this isn't my idea, but the IT people I work with, the general feeling is that smartphones and tablets are probably a more stable platform for patients to use. Desktops and laptops have more moving parts. There may be operating system updates that the patient never did. My wife's actually a great example, although to her credit, she finally is retiring a 10-year-old iMac this week. And so the general feeling is most people will, their smartphone or tablet will be more recent and probably more compatible. You're actually going to want to wind up on this page too. You're going to need the client for meetings. In fact, you probably already downloaded it and you just didn't know it. That's how we're conducting this meeting. But this is sort of where all the apps live. So that's a long answer. I think any tablet of recent vintage will work, and hopefully the patient is sort of kept up on the software updates, the operating system updates.
Okay, thank you. Let's see.
Here, I've got one, Joe, that has
Go ahead, Peter.
come through from a couple of different people. So, Dr. Frenz, do you have any opinion about doxy.me as a as a tool to use for telehealth?
I don't, honestly, when I spun up my private practice about 3 years ago, I looked at it. I more than looked at it, actually. I registered to play with it. And so it's been 3 years since I've actually played with the technology. I guess from a buyer's standpoint, the things that are really important to me, the ability to, well, first of all, security features. You want to make sure you have adequate security features. But more importantly for me, it's the screen sharing piece. That to me is really important for the work I do. I want to be able to, again, engage people in a way that's similar to the care in my office. So the ability to, again, show them the materials that I've showed you on my screen. So screen share is key. It's not just the AV tunnel. The audio, an encrypted audiovisual tunnel is not all that exotic. Your iPhone has that. It's more of the bells and whistles, the things that you can do. Talking in a secure way through a tunnel is no big deal. I need the other stuff. That's what impresses me with vendors.
Thank you, David. I have a question, and then Peter, if you have another one, you take the next one.
Okay.
Rachel says, professionally, I coordinate mental health services in a Minnesota school district. All of our agencies have shifted to telehealth. Personally, my son, 13 years old, participated in a telehealth therapy session yesterday and loved it. What is the probability that HIPAA will continue to allow for this form of therapy more easily?
Well, that's a great point. So, again, I should make this clear. I am not getting any commissions from Zoom. But another reason I like Zoom is a lot of schools have latched onto it. So the kids, at least in Minnesota, children are using it for distance learning. And so families are using it for other reasons. And so, uh, you know, using it doesn't create more complexity by requiring them to use another app. It can sort of be their portal. From a HIPAA standpoint, there's really no HIPAA issue. It's really a payment thing. Will the payers continue to reimburse for services in that way? I mean, HIPAA, as long as you protect PHI, protected health information, there's not an issue. So just achieving compliance in that realm is not a hard thing. The barrier really to the virtual expansion for years has been the payers. Are they willing to pay for services on par or even close to on par as in office? And I agree. I was training a psychologist yesterday who runs a group for teens. I mean, this is perfect. I mean, it looks like the rest of their life. So long answer short, I hope it stays. I mean, I think it's going to be hard to claw it back. I mean, Medicare says, well, this is a temporary waiver during the public health emergency. I kind of think patients will revolt. I mean, they're going to say, look, it worked perfectly well. It saved me time. There was a lot of things about it that were great. I think it's going to be hard to undo. But again, hard to predict.
Okay, here's another one from Peter, not me, Peter, but a different Peter. Hi, how do you ensure that home drug testing is done legitimately, but without false samples?
Yeah, I mean, so there's vulnerabilities. I'm not gonna shade on that. I mean, people could substitute a urine. If you really wanted, I'll tell you, this is largely for Suboxone patients, and so in order to substitute a urine, that's the usual way you're going to beat a drug test, is you're going to substitute or dilute a urine. My Suboxone patient should be positive for buprenorphine on the assay. And so if it comes back as negative, I have a different problem. It's like, well, it doesn't look like you're taking your meds. I mean, in reality, they probably substituted a urine. So I'm not worried about that circumstance, because usually the test comes back positive for buprenorphine, as it should be, negative for other stuff, as it should be. We're good to go. I have heard other clinicians, this gets to be a little bit of work. I have heard other clinicians kind of do it almost live, where the package comes in the mail, the patient's instructed not to open it, and then on a random basis, there's a session established. The patient is made to open the box on screen so that you can see that it's been opened on screen. They go off to their bathroom, put the urine in the cup, bring it back, and seal it on screen. So again, I mean, they could tamper with it. I mean, they could do sort of stuff, but I mean, they can do that in your clinic too. Really, the only way to sort of get around that is an observed UA, which I seldom do. I can come up with a lot of other ways to mitigate risk short of an observed UA. So a diffuse answer, but not super duper worried about it. And then honestly, I've said this for years. I mean, again, I've done addiction since 2005. Addiction declares itself. Seldom does the result of a single test make or break the treatment plan. Addiction's a pattern, as you know, of problematic substance use. It's pretty hard for people to hold it together. And so usually addiction declares itself in time.
All right, thank you, David. That's great to know. I have a couple more questions here. And this goes back to what you were saying earlier. Natalie asked, how do you keep kids engaged during therapy sessions, especially when younger ones have a hard time sitting still for long periods of time?
Yeah, we talk about, I work for a health plan part-time too. We talk about gamifying things. So how do you get diabetics to do what you want them to do? Measuring their blood sugar, taking insulin. And one strategy is gamifying it. And kids are eminently gamifiable. I mean, I have 3 of them. And so, one way to gamify it is there's the chat session. And so I don't know if you've noticed this, but you can chat privately. And so you can have crosstalk going on with people. You can, again, if you wanted to give an affirmation to a client, you can do that privately. It doesn't have to go to the group. If you have to rein in a client, you can do that privately. It doesn't have to go to the group. There's other features you probably didn't notice. There's reaction options where you can give thumbs up, raise your hand. At least in Zoom, there's those features. And so you can sort of gamify the experience. Screen shares, again, I think allow you to gamify things. There's all sorts of creative ways that you can make it more of an interactive experience and not just a data dump.
Right. Peter, do you have one more question?
Yeah, I can do one more. This is an easy one. This person wants to know what was the document camera that you showed?
Oh yeah, I'll flip to it. So, here's the blog post. I landed on IPEVO. And so the link is right here. I went with the middle one because it's wireless, but you wouldn't need that. The entry level one is just fine. It's a simple USB device. There's the USB cable that plugs into your computer. And it goes up, it goes down, it turns. There's free software that comes with it. Again, I ripped this off from teachers. Teachers have been using these sorts of things to project things onto smart boards and walls. So stuff that's on a desk. So you could use this for self-rating forms, stuff that you present on paper.
Right. And one final question here, and I want to remind everyone that we are working to have Dr. Frenz's colleague, his lawyer, on a webinar next week to have a live Q&A session after that presentation as well. So hang with us. We will answer all your questions.
Yeah, I would
David?
love to drill into the waivers with her. She lives that stuff, and so I'm just a doctor, the wrong kind of doctor. I'd love to get into it with her. She'd be fabulous.
Perfect, perfect. Crystal asks, how would you be able to help a client who is nervous or anxious about having sessions through telehealth?
Yeah, I've had that question actually from a clinician. Where clients worry about the security of the session, things like that. Everything in life has risk. I drove downtown today and there was a small amount of risk involved with doing that. So I think the psychoeducational piece is to use metaphor and demonstrate, well, you do all sorts of things. You ate food this morning, that had, you point out that like the benefits of the activity this way outweigh the risks. And really the risk is going without care. And so I would engage them in that discussion. So without making them overly paranoid, because these can be thought disorder people. So I don't want you to create new delusions about the food they're eating. But to the extent that you can point out that nothing in life is free of risk, we'll take all reasonable precautions to protect data security. And the risk is if you go without care, things could be a lot worse. And so I think if you frame it the right way, you'll get people to do it.
Thank you, David. And that's a great segue. I have two comments and then we'll wrap it up here. Josephine says, a fellow colleague has been offering free 5-minute sessions to clients reluctant to use virtual formats to lessen the fear, which
Brilliant.
I think plays into what you were just saying.
Brilliant.
And Monica wanted to share a tip. Blue light glasses are great for staring at the screen all day. I agree, Monica. David?
Yeah, I mean, as long as you look professional still. My kids, I mean, they have these creepy sort of setups with LED lights and all that. So, I mean, as long as you still look professional, I think that's great. Hey, Joe, back to that question about the 5-minute session. I think that's great because the other thing that you can point out is like they're using this technology already. I mean, they're texting people, they're emailing people, they're FaceTiming people for social reasons. And so it's not a big leap really to use it. for professional services. It'd be one thing if they weren't doing it at all, but these are usually people who already have smart devices and they're using this technology in other ways, and so I don't think it's a big leap.
Oh, no, they're likely more techie than many of us here today.
Right.
Well, that's the time we have. On behalf of the Center for Practice Transformation, thank you all for joining us. We hope you're staying happy, healthy, and safe out there. An extra special thanks to Dr. David Frenz for sharing his time and talents with us, and we'll be hopefully seeing him again next week.
I'm up for it, Joe.
Great, great. Well, everybody have a safe weekend. Oh, quick reminder, I will be sending the video link out today because so many folks registered and weren't able to join due to room capacity issues, which I'll be working on toot sweet. So please hang with us there. Give us a little extra time to get that email out. And by about 3 o'clock Central Time today, I'm hoping to have it ready. Thank you all and be safe.